Thank you. So now, in representation of the students working in Brazil, I will present the extended approach of One Health. So given the tumultuous political situation in Brazil, the impact of the pandemic, and the state-level message of economy over health and environment, there has been little advance in One Health policy and One Health action. Through an exploratory analysis of the One Health status quo in Brazil, evidence suggests that there has been some actions related to the One Health in the last years. The focus of One Health has been on zoonotic diseases, and the One Health actions also working on transversal topics such as zoonosis hotspots and One Health training. The One Health actions have been focused on education and knowledge management, surveillance, identification, and control of disease. Examples of this education and knowledge management are, for example, the One Health Summer School held last year, and a series of trainings and congresses and symposium that were developed during this year, especially in the context of the COVID-19 pandemic. An interesting example of actions taken at the state level is the work done by the Paraná state to promote One Health multi-sectoral collaboration. We identified 4 kinds of policy instruments that are already put in place, working with topics related to One Health: regulatory, economic, and fiscal agreement-based, and information and communications. Examples of them are, for example, the National Surveillance Systems Agent's resolution to manage waste disposal of veterinary drugs. Also, there is a discussion paper on Our Planet, Our Health, Our Future, launched at the Rio+20 United Nations Convention. And as actors, we identified a diverse set of actors, mainly the state agencies such as the Ministry of Health, the Ministry of Agriculture, and universities and research centers, and also an interesting public-private partnerships at the municipal level dealing with animal health. In terms of the knowledge management, there are institutions already working to advance One Health in the country, such as the One Health Commission and the One Health Platform, and also the World Organization of Animal Health. There is also an interesting cooperation between the Institute Pasteur and the University of São Paulo, and they are developing research on emerging pathogens and methods to prevent epidemics of infectious diseases such as Zika, dengue, and yellow fever. Although we observe some engagement trying to bring the One Health concept to multiple sectors of the Brazilian government, initiatives stayed at the academic and the extension level. Brazil still lacks a target-oriented and multi-collaborative One Health policy to be applied at the multiple Brazilian context. Having said this, we cannot ignore the elephant in the room and thinking about the environmental component and its neglected role. For the case of Brazil, we focus, and specifically for the city of São Paulo, we focus on the multiple benefits that urban agriculture provides, and also the green spaces benefits for mental health and wildlife support. Urban green infrastructure in the form of parks, street trees, and gardens improves environmental quality within the city and also provides many services such as pollutant filtration, microclimate regulation, noise buffering, stormwater regulation, and biodiversity support. Through the provision of this improved environmental quality, opportunities for improvements on the physical health of humans come together, but also the promotion of the social interaction, the stress reduction, and the association of lower levels of adverse health outcomes such as cardiovascular and respiratory diseases. In the case of São Paulo City has a lot of green cover. Almost 20% of the municipality is covered by green spaces, but the distribution is unequal. Most of it is located in the south and in the north, And in the rest of the city, the distribution is insufficient and unequal. Furthermore, the quality of the green spaces affects the potential benefits they can provide to visitors. For instance, the potential for mental restoration varies amongst parks, following the perceptions of environmental quality and maintenance. Green space quality is also reflected in the capacity to support a diversity of wild fauna, which might potentially also boost human health benefits and other ecosystems provided. In this sense, my colleague Jessica Felapi, part of the graduate school, developed this framework based on the One Health approach, identifying the urban environmental health, the human health, and the animal health, and the interactions associated among the three components. She tries to depict in this framework the interlinkages between the green space quality, the mental health, and the wildlife support, identifying the relationships at the local fine scale, in this sense parks, but there can be other green infrastructures, and the adjacent landscape. In the environmental dimension, we see that the landscape attributes and the spatial configuration, the vegetation structure, and the design and management of the parks have an association with the human health in terms of the degree of the restorative experience they provide, but also on the wildlife they support. Following this discourse, I would like to talk about urban agriculture in the city as a benefit multiplier. Well, multifunctional agriculture performs several ecosystem services and functions and interacts with several socioeconomic and health factors, creating various benefits to the communities while also promoting biodiversity and safeguarding the ecosystem services. Using this very comprehensive conceptual framework from Sulas and colleagues, we are identified the functions that urban agriculture performs in the city. We are focusing on urban agriculture, on home gardens, and enclosed countryside, which is more related to the urban rural areas in the periphery. So, these three types of urban green infrastructure perform the food provision, which is the one we are investigating in this graduate school, but empirical evidence provides information about the role that urban agriculture plays in other ecosystem services. For example, the air quality, the soil and nutrient cycling, the aesthetic and spiritual value of these infrastructures. In terms of the ecosystem health, we are analyzing the vulnerability and the adaptation of the green infrastructure to the shock of the drivers that we spoke today before, but also there is empirical evidence provided that these spaces provide habitat and species support, energy and materials cycling, and also water quality. They improve the water quality. In terms of the socioeconomic health, we are taking a look at the income and education, at the employment, at the access to housing services, and also at the lifestyle decisions of the communities and of those people engaged in urban agriculture. In terms of the community health, we're investigating the social capital, but we also recognize that urban agriculture has a potential to improve the community empowerment and identity. And in terms of the physical health and psychological health, urban agriculture has direct impacts on cardiovascular diseases, positive impacts, but also in the restoration and the stress reliever, and also on the positive thoughts of those engaged into urban agriculture. So this is just an example of how multifunctional agriculture is and how we need to conceive it when implementing it, and conceive all the factors of health that urban agriculture and urban green can bring to the urban ecosystem. We took a look at the policies put in place dealing with urban green and health in the city of São Paulo, and we found three very powerful instruments: the strategic master plan, the family health strategy, and the plan of food and nutritional security. So these policy instruments are already acknowledging green infrastructure and its multifunctionality, but there is still the need to adopt a holistic approach and also to identify the new roles that urban green adopts across sectors. In Sao Paulo City, these instruments already integrate the factors of health and green, but we still observe a weak collaboration among sectors. A very interesting example is this program, the Green and Healthy Environments Program. It's a program where the Ministry of Health and the Ministry of Environment join forces together to develop interventions at highly social vulnerable communities, where they identify their concerns, their environmental concerns, and they also started to provide basic health services. After the analysis of these concerns, they implemented interventions focused on biodiversity and waste management, and it's a good program that is already put in place, but we still observe that there is no explicit assessment or monitoring of health outcomes, and there is a limited cooperation among sectors. The main health drivers addressed into all these instruments are the nutrition, the food security, the physical and mental health, the zoonotic diseases, and the ecosystem health. So after this exploratory analysis, we identified some entry points to start building One Health approach or municipal policy from the bottom up. And the first one is that we agreed that the multi-stakeholder collaboration between the Municipal Council of Food Security and Nutrition should continue, but they should seek for a stronger link to the public health. Urban agriculture and urban green should explicitly be integrated into urban planning, public health, climate change mitigation, and adaptation policies. When designing parks, the targets of availability, accessibility, and quality should be taken into account. And also, there should be priority areas to implement green infrastructure, considering an equal distribution across the territory of the city. We also believe that the integration of multifunctional green infrastructure into new urban development should be done. And also, there is the need to assess the current urban green, identifying the roles they adopt across the three components of One Health. And finally, well, the One Health approach might contribute to practical guidance on more effective green space design and management to maximize socio-ecological benefits. Thank you. If you wish to contact my colleague that is not here, Jessica Felapis, she's working with the urban green spaces, and myself, I'm working with urban agriculture. Thank you.